Hi, so again, my name is Tara Wells, and I'm at the Ronald McDonald House with my kiddo. We have a procedure tomorrow for her, and so I had to find a space in the dining area kind of closed off where I wouldn't be around other patients. So if someone comes in, I have to throw my mask on. But so the way that I like to learn is color coding, and it helps me to memorize and get things in my brain. And lists. So what I created and what I use, because I didn't create what I actually use to memorize this stuff, were kind of different. So I put a picture on the bottom of what I actually use. But how I labeled them in my list that I created was electrolyte, what the electrolyte was, function, hyper, high, or hypo, low. So the first one, for instance, is potassium, so 3.5 to 5.0. The way that you can remember that is that bananas usually have 3 to 5 per bunch, so 3.5 to 5.0. The function, PPP, potassium priority, since it pumps the heart and muscles. So potassium priority pumps heart and muscles. And hyper high is hyperkalemia, so that would be over the 5.0. It's when your heart is tight and contracted. The first elevation and peak T waves, the second severe VFib or cardiac standstill. A third could be hypertension or bradycardia. Hypotension and bradycardia. GI symptoms could be that tight and contracted, so diarrhea, hyperactive bowel sounds. Neuromuscular would be tight and contracted, paralysis in extremities, increased DTR, profound muscle weakness, and general feeling of heaviness. So hypokalemia, which would be below the 3.5. Your heart is low and slow, flat T waves, ST depression, and prominent E wave. Muscular, low and slow, decreased DTR, muscle cramping, flaccid paralysis or paralyzed limbs. The GI would be low and slow as well. Decreased motility, hypoactive to absent bowel sounds, constipation, abdominal distension, paralytic ileus, and paralyzed intestines. So a priority for SBO or small bowel obstruction. So that is potassium. What I really like to use though on these, I'm not a nurse, I'm not planning to be a nurse, but nurse in the making, little plug for her, I don't even know her, but on like Etsy and YouTube and Instagram, whatever, she has these really great charts that I really like how she lays them out. So for instance, for potassium, which I've color-coded as red, hyperkalemia and hypokalemia. So for hyperkalemia, murder. She does a lot of mnemonic devices, which I like. Muscle cramps, U, urine abnormalities, R, respiratory distress, D, decreased cardiac contractility, low heart rate and low blood pressure. ECG changes, so tall peaked T waves, flat P waves, widened QRS complexes and prolonged PR intervals, and then reflexes, increased DTR. So that's hyperkalemia. And then hypokalemia, she has thready, weak, irregular pulse, orthostatic hypotension, same as the list that I created, shallow respirations, anxiety, lethargy, confusion, coma, paresthesia, hyporeflexia, hypoactive bowel sounds, so constipation, nausea, vomiting, abdominal distension, and some ECG changes like the ST depression, shallow or inverted T wave, and the prominent E wave. She also has risk factors, so medications like NSAIDs, ACE inhibitors, excessive potassium intake, so like rapid infusion of potassium containing IV, kidney disease, tissue damage, acidosis, actual total body potassium loss, movement of potassium from the extracellular fluid to the intracellular fluid. And then that potassium imbalances can be life-threatening with cardiac dysrhythmias. So the management, it's listed as signs and symptoms, risk factors, and then management. The management is to monitor the EKG, discontinue the IV and PO of potassium, potassium excreting diuretics, prepare for administration of IV calcium, gluconate, and IV sodium bicarb, avoid the use of salt substitutes or other potassium-containing substances, oral potassium supplements, liquid potassium chloride, potassium-retaining diuretic. So potassium and sodium are opposites. For example, sodium is up, potassium is down. So I like just how it's kind of laid out there. So that was potassium, so let's do sodium. For sodium, I have it as yellow, because she has it as yellow too. Hypernatremia is high. Hyponatremia is low. So hyper is greater than 145 and hypo is less than 135. So there's also a place in here that gives you mnemonic devices to memorize. So sodium, you just have to commit it to memory, 135 to 145. But potassium, again, they're about 3.5 to 5, or 3 to 5 bananas in every bunch. And you want them half ripe, so 3.5 to 5. For phosphorus, 4, PHOR 4, us 2, me and you 2, so 2.5 to 4.5. Calcium, 911, call 911, CA, call 911. Magnesium, a magnifying glass, is 1.5 to 2.5, bigger than normal. So that's how you can memorize magnesium. And then chloride, think of a chlorinated pool. When it's hot, you want it to be 95 to 105. You want to swim when it's hot outside. So that's a cool way to be able to, and helpful way to be able to remember those. So back to sodium. So on my list, I did sodium swells the body, so SS, sodium swells. So to maintain blood pressure, blood volume, and pH balance. So hypernatremia is big and bloated. So your skin will get red and rosy. You'll have water, bed skin from edema, sometimes a low-grade fever, polydipsia, which is excessive thirst. The late and serious signs are swollen dry tongue, the nausea and vomiting, and the increased muscle tone. And then for hyponatremia, below 135, you'll have neuro, which could be seizures and coma, the heart, tachycardia, and weak thready pulses, and then respiratory arrest. So that is sodium. She doesn't necessarily list out chloride or phosphate in this, but so for chloride, I did sodium sidekick, kind of goes hand in hand with sodium. So blood pressure, blood volume, pH balance. So hyperchloremia is over 107, because the range is 97 to 107. So nausea and vomiting, swollen tongue, confusion. And then hypochloremia is nearly the same as sodium. So excessive diarrhea, vomiting, sweating. So a test tip on that one, or something to remember, is that the fever is the only difference for hypochloremia. And it's, again, below 97. So then we have magnesium, which I have as purple. So the magnesium imbalance. She has a memory trick. Magnesium is a sedative, so everything is sedative. So on hypermagnesemia, I can't say that word right now, sorry. Greater than 2.5. So low energy, low heart rate, low blood pressure, low respiratory, so bradypnea, low respirations, low bowel sounds, and low DTRs, or deep tendon reflexes. So also muscle weakness with that one. So on hypomagnesemia, it is high everything, so not sedated. So you also need to remember that this is seen The positive Trousseau sign, the carpal spasm that's caused by inflating of the blood pressure cuff, can also be in hypocalcemia, and calcium and magnesium rise and fall together. So high everything, so not sedated, hypomagnesia, less than 1.5. So high heart rate, high blood pressure, increased deep tendon reflex or hyperflexia, shallow respirations, twitches, tetany and seizures, irritability and confusion, convulsions. So the risk factors, magnesium containing antacids like Tums and laxatives, you have to watch those. Renal insufficiency, diabetic ketoacidosis, insufficient magnesium intake on hypo. Risk factors for that could be sepsis, hyperglycemia, celiac and Crohn's disease. Sometimes people have insufficient magnesium intake with that. And then the management on hyper, diuretics, hemodialysis are some. And then hypo would be magnesium sulfate IV or PO. And then seizure precautions, and then just instructing the patient to increase magnesium containing foods. So magnesium and calcium are similar. So if magnesium is up, calcium is up. So that's something to remember with that. Which one have we not done? We have not done calcium. So calcium, and so on my chart I did the magnesium M's. So magnesium mellows the muscles, so relaxes. So M. And then hyper again over 2.1 and hypo below 1.3 on that. So let's see on calcium. So keep the 3 beats strong, bone, blood, and beats for your heart. That's one way you can remember that. Or on, and that is calcium's range. Remember 911, call 911, CA, about 9 to 10.5 or 9 to 11. So calcium is used to keep the 3 B's. So it keeps your bones strong, keeps your blood healthy, and keeps your heartbeat going good. So hypercalcemia would be over 10.5 or over 11. So hyper, one of the mnemonic devices you could use would be BACME. So bone pain, arrhythmias, cardiac arrest, kidney stones, muscle weakness, and excessive urination for hypercalcemia, so above like 11. And then hypocalcemia, so below 9, would be CATS, go numb. So convulsions, arrhythmias, tetany, spasms, and stridor. And then go numb, so numbness of the fingers, face, and limbs. Again, the positive Trousseau's, and then Chbosky's signs as well. Contraction of the facial muscles with light tap over the facial nerve on that one. So think C for a cheesy smile on that one. And then I did some risk factors, increased, so for hypercalcemia, increased the calcium absorption, kidney disease, some of them for hypocalcemia, inhibition of calcium absorption from the GI tract, so increased calcium excretion, so kidney disease, diarrhea, and wound drainage. The management for that, so for hyper, you would administer phosphorus, is one way. Avoid foods high in calcium. And then for hypo, consume foods, obviously high in calcium, 10% calcium, acute calcium deficit. And you could administer calcium PO or an IV. So a client with a calcium imbalance is at risk for a pathological fracture. So you have to move patients really slowly just so that they don't break a bone. Calcium and phosphate are inverses. So if one's high, the other's low. So calcium and phosphate opposites. If phosphate is high, calcium's low, and if phosphate is low, calcium is high. So that is calcium. And then phosphate range 3 to 4.5. And then, let's see, phosphorus, that was the 4S on the memory chart. And then it helps with bones and teeth formation, helps to regulate calcium. And then hyperphosphatemia, so over 4.5, would be the Trousseau sign, the Przewalski sign, diarrhea, and weak B's. So strong bones, if they're weak, then that's fractures. Strong blood clotting, so if it's weak, you have a risk for bleeding. And then the heart, irregular heartbeats as well, and rhythms. Hypophosphatemia would be below 3.0. Swollen and slow, moan, groans, and stones. So constipation, decreased DTR, severe muscle weakness, decreased heart rate, respiratory rate, and increased blood pressure. So getting these in your brain is kind of hard, so I liked the opportunity to be able to make the charts and look over them again and figure out different ways to be able to memorize these so that we can be better practitioners for our patients. So anyway, that's my chart.